Hi, my name is Vivian Papaiz, and I am the current chair of our Nipissing Serenity Hospice Board. I'd like to tell you that I am a registered nurse, and I've been a registered nurse for just over 30 years. I am very much interested in hospice palliative care and have for a large part of my career. I was a clinician for many years, and then assumed roles in management and looked after nursing staff and PSWs and other allied health throughout my career. I currently am an educator, and I am the Director of Operations for the Faculty of Health Sciences at Canada College and the Director and Program Manager for the collaborative BSCN nursing program that we have between Nipissing and Canada. And I am passionately involved in palliative care and have been for many, many years. I've had the experience of looking after many patients as they ended their life, as they came to their end of life, I should say. And I can tell you that it has been a great privilege for me to be involved with people and caring for them, in those very vulnerable times. And I feel that I've wanted to continue that work, and I came to North Bay about 4 years ago, moved here for a position, and I was involved and asked to become involved with the hospice and the hospice board. So I've been with the hospice now for a few years and have journeyed this beautiful build with them during these many months. Okay, so the board has been considering the position of MAiD in the hospice for quite some time, and I think it's important for the people of North Bay and our surrounding districts and our community to understand how the board came to this decision today. When legislation was enacted in June of 2016, there were many hospices across Ontario that had been practicing and already involved in care delivery for patients and palliative care. And then MAiD was enacted in June. And in our community, people began to ask questions about MAiD and wanting to better understand what is the situation and how does it get involved with hospice and what is the role of hospice as compared to MAiD. So it was very early days, and we were just beginning to understand some of those things ourselves. Our fundraising committee, the Capital Campaign Committee, was out there speaking to people, raising money, asking for donations related to our hospice, and of course there were many questions in the community about MAiD and the role that it would have. We, as a board, began to have those discussions. We were not knowledgeable at that time around MAiD, so we informed ourselves. There was information that was coming from our provincial association about MAiD and what was happening in other hospices. And we were provided some guidance and direction at that time to say that hospices were having to make a decision about how they wanted to manage MAiD. So, for example, some hospices decided that they would provide MAiD within their facility. Other hospices believed that while MAiD is a legislative right for people, that in fact they would not provide MAiD themselves, their staff, but would have an outside organization come in and provide MAiD. And the third option was that hospices would not provide MAiD at all. They were watching and waiting to see how the medical system was going to manage that, how our healthcare system was going to be providing direction to healthcare facilities around this topic, and had made that decision. And up until that time, our board, the board that had started the hospice for North Bay back in 2011, were working under the principles of the palliative approach to care, which is really about caring for people, providing them the quality of care that they need to have until their natural time of death. Those are the principles, the national principles of hospice palliative care, and those were the ones that they had been working towards. So in the fall of that time, during the many discussions that we had, the board deliberated extensively over this situation, and they decided that perhaps taking a middle-of-the-road approach, that while we would not accept a patient for the expressed procedure of medical assistance in dying, if a patient became interested in the procedure and wished to have a referral or be considered for the procedure and were able to meet the criteria of the procedure, that in the end they would not necessarily be moved out of the hospice. And that was the position that we sat on. We were relatively, new to all of this process. The legislation itself was still relatively new, and we understood that there would be changes coming over time, that there would be experiences that we would learn about. There may be even legislative changes, and so decided that, we would wait and see how things came along. Then, in the fall of 2019, there was new information that came to the board. There was a number of things that happened at that time that required us to relook at the MAiD position and to see whether or not it remained a viable option to occur within the hospice. The first thing that happened was we had board members that had changed over. Some had retired and some had left the board, and we had new board members come into our board. We also were anticipating the opening of our hospice either in late fall or early winter for us here in North Bay. So we had a retreat. We had a strategic planning day for our board. And it was really a time for these new board members to have an opportunity to talk about some of the issues, to express what was important for them as board members and what kinds of things they wanted to uphold within the hospice as it became open and we were now providing service. So one of those things was the MAiD issue, of course. That's the first thing that happened. Secondly, we reviewed during the strategic planning time our mission and vision statements, and we really looked at, what's the value that we were going to be giving our community. We understood that hospice was very much needed, and that we were progressing very well through our build, and that we had anticipations of all of the great care that patients would be receiving here. We were looking at the staffing model and the medical supervision that would be here at the hospice, and we wanted to ensure that people received the best possible care that they could. Also, at that time, our two national organizations, the Canadian Hospice Palliative Care Association and the Canadian Society for Palliative Care Physicians, had released a joint statement that really looked at the issue of MAiD and where it fit in the palliative approach to care. And they were very clear that they didn't feel that medical assistance in dying was really something that fell within the framework of palliative care. And they were very clear about that. So while the approach to care, hospice palliative care, is about caring for someone, giving them the best potential care they can receive, excellence in care that included excellent pain management and control of symptoms, but also support and love and caring to their family members so that they can live their life peacefully until its natural end. MAiD, or medical assistance in dying, was really about planning to end life at an earlier time or in advance of their natural death. And so therefore didn't address all the pieces that hospice and palliative care does for someone who is living with a life-limiting illness and coming close to their end of life. The other thing that happened that's important to remember is that we were starting to get information around how MAiD was being managed throughout the province and across Canada. And one of the things that we learned was that in our community in North Bay, the medical assistance in dying was being managed very well. Our residents and our citizens of North Bay can receive medical assistance in dying, the procedure itself, in their home environments, in long-term care facilities where they live now, and for sure at the hospital. The hospital's medical staff and nursing staff are specialized, have specialized training to be able to administer this procedure. So, we knew it was readily available throughout our community. And so when the board came together during this retreat and looked at all of these pieces of information, all very critical to decision making on their part, made an informed decision and felt very clearly that they wanted to uphold the standards of hospice and palliative care. They wanted very much to be able to ensure that people have a place where they can come, where they can receive the care that they wish to have, to be comfortable and to be supported, and to know that if they wish to have MAiD, there were many options available within our area. So generally, that was the position that the board took during that retreat. And we had promised the community that while we had a tentative end-of-life statement, and I call it tentative because it's not in policy or anything, but we were dealing with information as it became available to us back in the time when we had produced a first end-of-life statement. That at this time we felt that there was a need for a change. There was a need for us to refresh what our end-of-life statement was based on all of this new information. So in January, before our official opening, the board had unanimously agreed that we would certainly support our patients in our facility, and if they were interested in MAiD, we would provide them with referral and assist them wherever possible to get the information that they needed to have, but that the actual procedure would not necessarily occur in hospice. It is important to know that there are, of all the hospices in Ontario, none of the hospices actually admit for the purpose of MAiD. There are some hospices that will allow the administration, but the majority of hospices do not. So in keeping with what is happening provincially and the principles of hospice palliative care, it was decided that we would make this decision. There's been some communication in the media with relation to, certain individuals who are driving this decision, but I can assure you that the decision was unanimously agreed upon by the board, and that in fact, in my role as the board chair, I do not have a vote following governance proceedings unless there's a need for a tie break. So I just, we just want to make sure that our community is clear about the role of our community board and our stewardship towards palliative care here in our hospice. The board and medical staff, our nursing staff do not oppose MAiD. We are very aware of the medical assistance in dying and its legislative requirements and the rights of our citizens, of our Canadians, who wish to consider MAiD, to ask questions about MAiD, and to take advantage of their right to have medical assistance in dying. They're trained. They have knowledge, and they will provide referral and help and assist our patients should they ask for MAiD to meet the criteria if they can for the procedure. They're very knowledgeable, as I said, and there would be no reason for them to in any way to refuse a patient to have MAiD. The board and the administrative staff here at Nipissing Serenity Hospice are very much in communication with the LHIN, the Local Health Integration Network, the Ministry of Health, around all of our practices and our operations. We have regular meetings with them. There's regular communications and touch points, and we are always open to communication. They're our partners in healthcare delivery, and we're privileged to be able to be small part of our healthcare system, but still an integral and important part. And so we welcome and will always keep our communications open with them. Research has shown that people who come to hospice generally do not request MAiD. Sometimes the fear of the unknown, as people are thinking about their end of life, they begin to wonder, what is it going to be like as my life approaches its end? Am I going to be in pain? Will I be suffering from, symptoms? And is it going to be a terrible experience for me and my family? And it's often fear that drives the question or the wondering about whether MAiD is good for me. And so research has found that patients who come to hospice who are able to get that excellence in care, and that's not to say that care is not good in other locations. There are many organizations that have really expanded on the care in palliative care and end of life for their residents, their patients, and so forth. It is only that hospice dedicates their mission to that type of care, and because they do, they are able to really concentrate and provide that care for people. So, if their comfort needs are being met, and not only their own, but that their family is being supported and cared for and loved and fed, and all of the things that we can do for them in hospice, they often do not follow through with any referral or request for MAiD because they are supported to live their life comfortably until end of life. What we have seen is that the likelihood of MAiD being requested once they have been admitted to a hospice is very low. Research has shown that since legislation was enacted in 2016 of June to now, there have only been 5 requests from individuals who are in the hospice to have MAiD. They lived long enough in their end-of-life term to be able to meet the criteria, which is a 10-day waiting period, and were able to cognitively continue with their request for MAiD, so they were able to maintain their level of ability to make that request. And of those 5 people that did opt to take the procedure, 3 of them were discharged to their home, 2 were transferred to hospital, and we know that all 5 of those incidents were managed very compassionately and without incident. These individuals had opted for MAiD, they were respected in their decisions, and they were transferred out without cause. If MAiD is requested in the hospice, there is a referral process. So our nursing staff, our medical staff would begin the referral process. There would be a physician or a nurse practitioner that would come in and be speaking with the patient and their family and discussing with them what their options were. So that's the process. We are legislated by government to follow that process, and we do it very respectfully and willingly within the hospice. Currently, in our legislation, the only individuals that are allowed to administer the medical assistance in dying procedure are physicians and nurse practitioners. While nursing staff are on site and will help with the preparation of patients for the procedure, it is only those 2 levels of medical attention that can administer the injection. I think this is an important time to reiterate that the hospital environment is uniquely positioned to administer the procedure MAiD to the people. They are equipped with, they're specialized in their knowledge of the procedure. They know how to be responsive in the event that challenges come up in the administration portion, and they can respond very quickly to the needs of the individual. This doesn't always happen in other situations. So I think that it's important for us to know that, hospitals are the ideal place for the procedure to take place. The board of directors for Nipissing Serenity Hospice are volunteer members of our community, And they have been selected. They were individuals who applied to be board members, were interviewed, and were selected based on their knowledge and experience of administrative functions, their knowledge of palliative and palliative care and end-of-life care, and who have had a strong desire to participate and to be able to be part of this important movement that we call hospice and palliative care today. Decisions are not made, randomly. They take their role as stewards of our organization, of our governance structure, very importantly. They very seriously. They look for input. They look for feedback. They listen to the people of our community. They talk to the staff. They are have been involved in all aspects of the build of this building, as well as all of the administrative pieces. And I can tell you that their integrity towards this organization is very strong. While there has been some publicity around the hospice of recent time, around the MAiD issue and other things, I want you to know that the board of directors that we have today are very much informed individuals, and they take their work and their position here and the many hours that they offer very seriously and importantly, and recognize that they are upholding the principles of hospice and palliative care here. An example of that was that in, I believe it was October of 2016, the board had passed a motion at that time that they would not accept donations based on conditions. Really that, they felt that people needed to donate to the hospice because they believed in the principles of hospice palliative care, not because of an individual or a preferred preference of some type, or perhaps the type of care that they may be able to receive here. So I think it's important for us to recognize that and to know that, and to uphold the integrity of our position is of utmost importance to them. The publicity that the hospice has received of recent times has been an important point for us since we've had our opening in January of 2020, just this year. It's important for us to remember that, while there are people in the community who really believe that MAiD is an important part of their decision-making process as they consider all of their options as they near end of life, there are also many people in the community who feel that they wish to experience the hospice experience here, to be cared for and taken care of in a comfortable and a peaceful environment that doesn't include MAiD. So we are constantly considering and listening to all aspects of this conversation. All donations are important to our hospice. Every dollar that comes to the hospice has an impact and is significant to our operations and our bottom line. It's important for people to know that generally about 50 to 60% of funding comes from our government, and that's strictly for the medical services that a patient would receive. Other services such as our administration costs, our building costs, food, the purchase of food, keeping the lights on, keeping the heat on, all has to be paid for through fundraising dollars. So I think it's important for us to remember that if we want a hospice and if we want a place where people can come to that can benefit from this level of care, one that we've been talking about for a long time, one that we have been speaking of that was in much need in our community, I think we have to think about that. And I think we have to think about, where are our dollars best spent and why are the reasons that we're giving? Why do we give to hospital foundations? Why do we give to, other organizations? Why are we giving to hospice? Because we have felt that there's a need to have this hospice here and that we want to support it. in its fullest and best capacity. And it shouldn't be based on conditions. It should be based really on the ability to receive that care. Our community is very much in need of a hospice, as many communities are across this province and across Canada. Only 15% of all Canadians in 2017 was when the study was, actually received hospice palliative care and quality hospice palliative care. So the other 85% did not, those that were in need of that. So in their infinite wisdom, the people of North Bay and surrounding districts all these many years have worked very hard, recognizing that there's great need for hospice. Other healthcare facilities that work in our region are doing their very best. They are managing patients. They are providing the best care they possibly can. Still, there is more room for us to do even more, and that's where the hospice comes in. The hospice is a place where we can provide that care, that very important care that people need at end of life, when a time when they are most vulnerable and at a time when their family needs the support that they need to have. Many patients try to remain at home, for example, and there's not enough care hours for them. And so having an opportunity to come here where not just themselves are cared for in a comforting and quiet, peaceful place, but also that their family can be cared for, their needs can be cared for too. And so because of that wisdom that many people in our community had all these many years, we now today have a beautiful building here. We have state-of-the-art equipment. We have a staff that's been fully trained, that are here because they want to be able to provide palliative care. This is the difference, and this is how we can make a difference in our community. The success of the hospice falls on all of our shoulders. We, the board, the government, and all the members of our community, all the people that would have a need for hospice at some time in life. I know this statement has been said often, but death is inevitable. We will all die at some point, and how we want to have that period of end, how we want to live our life until our end is a choice that we're making today. As a board, your board takes their duties very seriously, takes their stewardship very seriously, and is very engaged in fundraising, trying to ensure that we are building networks and building communications with people in our community and expressing, what the needs are. Our government has been instrumental in helping us build this beautiful facility. Without their efforts and their lobbying for us, we wouldn't have hospices now. We wouldn't have our hospice here in North Bay, and many hospices wouldn't exist in Ontario. So we have to be grateful for that, because our dollars have gone to helping people have hospices in their community. And we ourselves, we as individual citizens of our community, are all responsible for the viability of our hospice. We have wanted this. We have worked hard to have this. The thousands of volunteer hours that people have provided and given of their time have all contributed to this build, and we all have a responsibility to this hospice. I guess I would end by saying that I think we all have to be reflective and look inwards and ask ourselves the question, does an issue such as MAiD in our community about whether or not we would have it in our hospice, is that really the right reason to decide whether we would donate or not? I think that we need to answer that question for ourselves. And think about what that could mean to this beautiful building that we've created, and how we can all continue to contribute going forward. The hospice is open to all individuals in our community who would like to come and have a visit and see what we're all about. We welcome your letters. We have welcomed your letters and your feedback your email messages, and all of your communications that you have sent to us. I can tell you that our board members read your letters, they read your emails, they're in constant communication with our lead admin staff, our executive director, around those communications. And we encourage you to continue to work with us and to share with us what your thoughts and your feelings are and how you think we can improve things. We are a community-based organization, and we value your input. This is spoken most sincerely to you, and I hope that we welcome you to come and have a tour, see the services that we offer, come by and check out our rooms and our kitchen and our sitting areas. We have a beautiful room for children, for families when they need to come here and spend time here. It's truly a beautiful place, and we want the opportunity to share it with you and welcome you anytime.